Today my topic of presentation is scabies and body lice. Bismillahirrahmanirrahim. Success is the sum of small efforts repeated day in and day out. Learning outlines. Today we discuss the introduction, epidemiological determinants, chain of transmission, communicability, clinical manifestation, levels of prevention, and recent advances relating to scabies and body lice. Learning outcome. By the end of this presentation, participant will be able to describe the epidemiological determinants, clinical features, and prevention strategies regarding the scabies and body lice. Scabies. Introduction. Human scabies is caused by infestation of the skin by the human itch mite known as Sarcoptes scabies. The microscopic scabies mite burrows into the upper layer of the skin where it lives and lays its eggs. Scabies is actually not an infection but it is an infestation. The skin does not take kindly to the invasion as the mites itch might burrow and lay eggs inside the skin. The infestation leads to relentless itching and angry rash. Problem statement. Globally, it is estimated to affect more than 200 million people at any time, although further efforts are needed to assess this burden. Prevalence estimate in the recent scabies-related literature ranges from 0.2% to 71%. Scabies is endemic in many resource-poor tropical settings with an estimated average prevalence of 5 to 10% in children. Recurrent infestations are common, but in high-income economics or countries, the cases of scabies are sporadic, yet outbreaks in health institutions and vulnerable communities contribute to significant economic cost in national health services. If we talk about Pakistan, one study conducted regarding the scabies prevalence and risk factor in Pakistan, which is actually hospital-based survey conducted in Pindi. This study showed that the hospital data revealed that the scabies contribution is 38% among dermatological disorders. The infestations, scabies infestation were higher in male than in female, and early school-going children were the most susceptible group for this disease. And the scabies were more common in urban population than in rural ones. Types of scabies. Clean man's scabies. This is seen in individuals who bath regularly and keep very clean. In this case, the lesions are minimal and hard to see. Itching tends to be not as intense. Infant scabies. This occurs in babies and young children and is often misdiagnosed or mistreated. Scabies will affect the whole body of the child and there will be a large amount of pustules. Scabies incognito. Normally, if a strong type of treatment such as steroids are applied, then the scabies are masked and the lesions are suppressed. This is known as scabies incognito. Norwegian scabies. This is intense case of crusted scabies. In this case, there can be hundreds or thousands of mites within the lesion. This occurs commonly in immunocompromised individuals or people who are mentally challenged. These Norwegian scabies, in which the crust are formed, or crusted scabies are highly contagious either by direct or indirect contact. Animal scabies. Animals are susceptible to scabies too. Domestic pets that can contract scabies are liable to pass it on the other animals of the households as well. Sign and symptoms of scabies infestation. Intense itching, pruritus, especially at nights, pimple-like papular itchy rash, and the itching and rash each may affect much of the body and may be limited to common sites such as wrist, elbow, armpit, webbing between the fingers, nipples, penis, waist, belt line, and buttocks. The rash also can infect the tiny blisters, vesicles, and scales. Scratching the rash can cause skin sores. Sometimes these sores become infected by bacteria. Tiny burrows sometimes are seen on the skin. These are caused by the female scabies mite tunneling just beneath the surface of the skin. These burrows appear as tiny raised and crooked serpingeous grayish white or skin colored lines on the skin surface. Because mites are often few in numbers, only 10 to 15 mites per person, these burrows are often most often in the webbing between the fingers, in the skin folds on the wrist, elbow, knee, and on the breast and shoulder blades. The head, face, neck, palms, and soles are often involved in infants and very young children, but usually not adults and older children. Scabies rash. Typically, the classical site of scabies are between the fingers, wrists, axillary areas, female breast, particularly the skin around the nipple, umbilical area in male scrotum and penis, buttocks inside of the legs and ankles. Epidemiological determinants: host, agent, and environment. Agent: it is caused by Sarcoptes scabiei, the human itch mite, which is an arthropod class Arachnida. Subclasses carry family Sarcopidae. The mites burrow into the upper layer of the skin, but never below the stratum corneum. The burrow appear as tiny raised serpentine lines that are grayish or skin colored and can be centimeter or more in length. If we see the life cycle of Sarcoptes caebi, the adult females deposit egg as they burrow. Eggs hatch releasing the larva. The larva mold into nymphs. Larvae and nymphs are found in short burrows called molting pouches, as we see. Mating occurs after the male penetrates the molting pouch of the adult females. And these impregnated females leave their molting pouches and excavate a permanent burrow in which they lay eggs. Thus, transmission occurs primarily during person to person or skin to skin contact. Occasionally, transmission may occur via fomites. Human scabies mites are often found between the fingers and on the wrists, areas which are highlighted in the red. And these are the most common sites where the rashes may occur and the adult females deposit eggs. Transmission. Scabies is usually transmitted person to person through close skin contact living in the same residence with an infested individual. The risk of transmission increases with the level of infestation, with highest risk due to contact with person with suspected scabies because it is highly infectious. Transmission due to contact with infested personal items such as clothes, bed linen is unlikely with common scabies but may be important for individual infested scabies. As there is an asymptomatic period of infestation, transmission may occur before the initially infested person develops symptoms. Humans are the source of infestation. Animals do not spread the human scabies. Scabies can be passed easily by infected person to his or her household members and sexual partners. Scabies in adult frequently sexually quiet. Incubation period. In people who never had scabies, it will take 4 to 6 weeks for symptoms to begin. During this period, the infested person can spread scabies. In people who have previously been infested with scabies and are exposed again, symptoms can begin within 1 to 4 days. But in newly infected person, it takes 4 to 6 weeks for symptom to begin. Complications of scabies infestation: the intense itching and scratching can cause skin sores. These sores can become infected with bacteria on the skin, such as Staphylococcus aureus or beta hemolytic streptococci infection. Sometimes bacterial skin infection can lead to inflammation of kidneys called post-streptococcal glomerulonephritis. In high-risk groups, it can easily be contracted by the old people in prisons, nursing homes, hospitals, and daycare facilities. How long scabies mites live? On a person, scabies mites can live for as long as 1 to 2 months. Of a person, scabies mites usually do not survive more than 48 to 72 hours. Scabies mite will die if exposed to temperature of 50 degrees centigrade or 122 degree height for 10 minutes. Now, level of prevention and health promotion. Primary prevention, it is basically health education, proper cleanliness and body care, frequent changing of underclothing and beds. Children who are infested should be excluded from the school and until this infection. Secondary treatment with early diagnosis whenever possible. Secondary prevention, early diagnosis whenever possible. The diagnosis of scabies should be confirmed by identifying the mite or mite X or fecal matter. This can be done by carefully removing the mites from the end of its burrow using the tip of the needle or by obtaining a skin scraping to examine under a microscope for mites, eggs, or mite fecal matter. However, a person can still be infested even if mites, eggs, or fecal matter cannot be found. Fewer than 10 to 15 mites may be present on the infested person who is otherwise healthy. However, person with crested scabies can be infested with thousands of mites and should be considered highly contagious. Treatment products used to treat scabies are called scabicides because they kill scabies, mites, or eggs. Scabicides to treat human scabies are available only with a doctor's prescription, and no over-the-counter products have been tested and approved for humans. When treated adults and old children, scabicide cream or lotion is applied to all areas of the body from the neck down to the feet and toes. Or when treated infants and young children, the cream or lotion also applied to the head and neck. The medication should be left on the body for the recommended time before it is washed off. Clean clothes should be worn after each application. In addition to infected person, treatment also recommended for household members and sexual contacts. All persons should be treated at the same time in order to prevent reinfestation. Retreatment may be necessary if itching continues more than 2 to 4 weeks after treatment or if new burrows or rash continue to appear. If we talk about scabies treatment, scabicides include 5% permethrin lotion, which is a treatment of choice. It applied from the neck down before bedtime and left on for about 8 to 14 hours and then showered off in the morning. On application is normally sufficient for mild infection. For moderate to severe cases, another dose is applied 7 to 14 days later. It may cause slight irritation of the skin, but the sensation is tolerable. Ivermectin, it is an oral medication often used as single dose treatment of choice for crusted scabies and often used in the combination with topical agent. It is not tested on infants and not recommended for children under 6 years of age. Topical ivermectin preparations have been also found to be effective for scabies in adults and are attractive due to their low cost, ease of preparation, and low toxicity. And it also has been used for sarcoptic manage. Other include lindane, benzyl benzoate, bromatin, malathion, and sulfur preparation, which can also use in the form of cream or lotion. But the treatment of choice is 5% permethrin lotion, and pay special attention to those areas where you put on the lotion and creams. Who should be treated for scabies? Anyone who is diagnosed with scabies, as well as his or her sexual partner and other contacts who have prolonged skin to skin contact with infested person should be treated with scabies. Scabicides. Treatment is recommended for the members of same household as a person with scabies. All persons should be treated at the same time to prevent reinfection. Retreatment may be necessary if itching continues more than 2 to 4 weeks after the treatment or if new burrows or rash continue to appear. Is it possible to get scabies from your pet? No, animals do not spread human scabies. Pets can become infested with different kind of scabies mites that does not survive or reproduce on human but cause managed in animals. If an animal with manage has close contact with person, the animal mite can get under the person's skin and can cause temporary itching and skin irritation. Although the person does not need to be treated, the animal should be treated because its itch mite can continue to burrow into the person's skin and can cause symptoms until the animal has been treated successfully. Can be scabies by spread by swimming pool in public pool? Scabies is spread by prolonged skin to skin contact with a person who has scabies. Scabies sometimes can also be spread by contact with items such as clothing, bedding, or towels that have been used by a person with scabies. But such spread is very uncommon unless the infested person has crusted scabies. Scabies is very unlikely to spread by water in the swimming pool, except for the person who has crusted scabies. Only about 10 to 15 scabies mites are present on the infested person, and it is extremely unlikely that any would emerge from under wet skin. Although uncommon, scabies can be spread by sharing a towel or items of cloth that has been used by the person with scabies. How can we remove itch mites from the clothes or house or carpet? Scabies mites do not survive more than 2 to 3 days away from the human skin. Items such as bedding, clothing, and towels used by the person with scabies can be decontaminated by machine washing in hot water and drying using the hot cycle or by dry cleaning. Items that cannot be washed or dry cleaned can be decontaminated by removing from any body contact from at least 72 hours. Because persons with crusted scabies are considered very infectious, careful vacuuming of furniture and carpets in rooms used by these persons is recommended. Preventive measures during scabies treatment outbreaks. Mass treatment programs that use topical permethrin or ivermectin should be used. In case of scabies outbreak, there is no vaccination available for scabies. The simultaneous treatment of all close contact is recommended even if they show no symptoms of infection or asymptomatic to reduce rates of recurrence. Families are treated all at the same time. Asymptomatic infection is relatively common. Rooms used by those with crusted scabies require thorough cleaning. Maintain high level of suspicion if patient present with undiagnosed skin rashes. WHO response. WHO works with member states and partners to develop control strategies and scabies outbreak response plan. WHO recognizes that the burden of disease and the risk of long-term sequelae need to be better defined and that control strategies must be integrated with existing activities in order to facilitate rapid cost-effective uptake of the strategies. WHO is working to have ivermectin added to WHO model list of essential medicine when it is next updated. Additionally, it is working to ensure that quality, effective medication will be accessible to the countries that need them. Now, next topic is pediculosis lice. Lice are the parasitic insects that can be found on the people's heads and bodies, including the pubic area. Human lice survive by feeding on the human blood. Lice found in each area of the body are different from each other. There are typically three types of lice that live on the human: Pediculus humanus capitis head louse, Pediculus humanus corporus body louse or cloth louse, Thyris pubis crab louse or pubic louse. Only the body louse is known to spread the disease. Introduction. In this lice, there is intense itching and pruritus and rash caused by allergic reaction to louse bites are the common symptoms of body lice infestation. As with other lice infestation, intense itching leads to scratching which can cause sores and secondary bacterial infection of the skin. When body lice infestation is long lasting, heavily bitten, areas of skin can become thickened and darkened, particularly in the midsection of the body, and this condition is called vagabond's disease. Body lice are known to transmit disease such as epidemic typhus, trench fever, and epidemic relapsing fever. Life cycle. The life cycle of body louse has three stages: egg, nymph, and adult. Eggs, nits are body lice eggs. They are hard to see and often confused for dandruff. Nits are laid by the adult female and are cemented at the base of hair shaft nearest the skin. They are 0.8 mm by 0.3 mm oval and usually yellow to white. Nits take about 1 to 2 weeks to hatch. Viable eggs are usually located within 6 mm of skin. Nymph. The egg hatches to release a nymph. The knit shell then becomes a more visible dull yellow and remains attached to the hair shaft. The nymph looks like adult body louse, but is about the size of pinhead. Nymph mature about after 3 months and becomes adult about the 7 days after the hatching. Nymph then become adult. The adult louse is about size of the sesame seed, has 6 legs, each with claws, and it's tend to grayish white color. In person with dark hair, the adult louse will appear darker. Females are usually larger than males and can up to 8 nits per day. Adult lice can live up to 30 days on a person's body, and to live, adult lice need to feed on body several times daily. Without the blood meals, the louse will die within 1 to 2 days of the host. Risk factor. Body lice infestation is found worldwide but generally is limited to persons who live under conditions of overcrowding and poor hygiene, who do not have access to regular clothing, bathing, and change of clean clothes. These include homeless people, refugees, survivors of the wars, natural disasters. Infestation can spread rapidly under such conditions. Body lice infestation can occur in people all races. Body lice can spread through direct contact with person who has body lice or through through contact with articles such as clothing, bed linens, or towel that have been in contact with infested person. Body lice can transmit disease. Epidemic of typhus and louse bone relapsing fever have been caused by body lice. Typical in areas where climate, poverty, and social customs and wars, social upheaval prevent regular changes and laundering of clothes. Diagnosis: body lice infestation is diagnosed by finding eggs and crawling lice in the seams of clothing. Sometimes a body louse can be seen crawling or feeding on the skin. Although body lice and nits can be large enough to seen within a naked eye, a magnifying lens may be necessary to find crawling lice or eggs. Treatment: a body lice infestation is treated by improving the personal hygiene of infested person, including ensuring a regular, at least weekly change of clean clothing, bedding. Towel used by infested person should be laundering using hot water at least 130 degree Fahrenheit and machine dried using the hot cycle. Sometimes the infested person also treated with pediculicide, a medicine that can kill lice. However, pediculicide generally is not necessary if hygiene is maintained and items are laundering properly at least once a week. A pediculicide should be applied exactly as directed on the bottle by your physician. Prevention and control. Body lice are spread most commonly by direct contact with infested person or infested person clothing or bedding. Therefore, body lice usually infest persons who do not launder or change their clothes regularly. Therefore, the steps to control and prevent the spread include bath regularly and change properly laundered clothes at least once a week and launder infested clothes at least once a week. Machine wash and dry infested clothing and bedding using the hot water at least 130-degree Fahrenheit laundry cycle and the high heat drying cycle. Clothing and items that are not washable or dry cleaned should be sealed in a plastic bag and stored for at least 2 weeks. Do not share clothing, beds, towels shared by infested person. Fumigation or dusting with chemical insecticide sometimes is necessary to control and prevent the spread of body lice for certain diseases such as epidemic typhus. Now it is time for MCQs. Human scabies is caused by infestation of the skin by the human itch mite known as Pediculus humanus capitis. Pediculus
B.
D. Correct answer is Sarcoptes cabi, which is also known as itch mite. In high income economics, cases of scabies are
B.
correct answer is sporadic. The highly contagious either by direct or indirect contact and most severe form of scabies is clean man scabies, animal scabies, Norwegian scabies, or infant scabies.
C.
Correct answer is B, because Norwegian scabies, as I already told, is crusted scabies and it is highly contagious, infectious, and spread by either by direct or indirect contact. The itch mite burrows into the upper layer of skin but never below the yes, stratum corneum. Correct answer. Dash are the source of infestation of scabies.
B.
Humans are the source of infestation of scabies and animals are not. I already mentioned, therefore correct answer is treatment of tribes for scabies is A. A 5% cleansing cream is treatment of tribes for scabies treatment. If a person has never been tested scabies before, how long will it take to
C.
correct answer is 4 to 6 weeks. As I already told, the person has never been tested for scabies, then it will take 4 to 6 weeks to develop the symptoms after initial infection. So correct answer is C. Common symptoms of body lice infestation include intense itching, pruritus,
A.
yes, correct answer is A. Intense itching, pruritus, and redness. When body lice infestation is long-lasting, habitual, parts of the skin can become thickened and darkened, particularly white section of the body. Inflammation is
Vagabond.
yes, correct answer is A. Vagabond disease. Lice-infested clothes and items that are not washable can be dry cleaned or sealed in a plastic bag and stored for at least 2 weeks.
A.
Correct answer is 2 weeks. This is the key of MCQs. reference.
Thank you very much, Dr. Khansa. Very nice presentation, especially what you have said about WHO response and how the ivermectin has been added to the model list of essential drugs. That is very important lessons for today. However, I want to know about your MCQ number 10. What is the rationale behind keeping the clothes in a plastic bag for certain weeks? MCQ number 10. Everyone, please mute your mic. And Dr. Khansa, would you please explain your MCQ number 10?
Reason behind this is the clothes which are not we can washable or dye clean, then it should be stored for at least 2 weeks. And the clothes,
My question is why it should be so.
because life cycle, due to life cycle of body lice, the
Usually, the egg hatches and become adult mites within 10 days, right? So, we know that we have to wait for 10 days at least for the eggs to get into mites form or adult mites form. So we have to wait for 2 weeks at least. So what is the time duration in which a person who has been exposed to scabies would start showing the symptoms of scabies? What is the time duration?
madam, if person is previously not infected, then it can takes 2 to 4 weeks to develop the symptoms, asymptomatic. And if
Very right. And what is the rationale behind it? It is again the same, that the egg hatches and become adult mites within 10 days. So it requires at least 2 weeks, and even the 4 weeks are required after the contact to show the symptoms. Moreover, what is in scabies, the different forms of contact? The most common contact is skin to skin contact. The other contacts, like with clothes, towel, and fomites, they are usually not very strong in transmission. However, they can transmit. The clothes that should be exposed to the hot cycle or to the sun exposure for at least 20 minutes. What is the importance of the chemoprophylaxis in scabies? Dr. Hansa, would you tell me more about it?
madam, it has is a important role because in case of epidemic, we can recommend the in it can be, in case of scabies outbreak, the mass treatment program should be given, especially of topical permethrin or oral ivermectin, and there is no vaccine available for scabies, and it can prevent the reinfection also.
Okay, if we are using oral ivermectin, what should be the regime and how it should be followed for chemoprophylaxis?
Um, Madam, 200 microgram per kilogram body weight is recommended, but as it is not tested on infants and not recommended for children under 6 years of age. It is mostly given adults, and it mostly given treatment of choice in case of crusted scabies. But the treatment of choice for scabies is permethrin lotion, 5% permethrin lotion. In case of
I'm not talking about the treatment, I'm talking about the chemoprophylaxis or prevention. And as you have said that for the prevention, we can use oral ivermectin, and the dose is 300 micrograms per kilogram, and that dose it should be repeated after 7 days, because there are two doses that are required at uh, to give the chemoprophylaxis against ivermectin. And most important thing is about disinfectant sprays that you have said about permethrin. Yes, it can be applied on surfaces as well as on skin and on clothes. However, for hard surfaces, it is alcohol or lysol that is used to kill the bugs. In order for the ivermectin, it must be noted that it is a drug that has been awarded Nobel Prize, and ivermectin has been included in WHO model list of essential drugs. And I have praised this fact that you have mentioned this point in your presentation, that ivermectin is one of the essential drugs that has been recommended by WHO. And there is a very good, incredible, I must say, discovery of ivermectin, because it was discovered from the soil samples. It is naturally present in the soil, and it was in 2015 that Campbell and the Japanese scientist Satoshi Omara, he got the Nobel Prize for, along with the Chinese scientists too, for the discovery of this incredibly safe as well as miraculous drug. How it was found? They were collecting the samples from the soil, and they were looking at the potential of decreasing the bacteria, parasites, and they found that it is the soil sample that contains Streptomyces evermicilius, and that is only source of ivermectin. Later on, this ivermectin, it has been used in many diseases. Apart from scabies, it has been used for lysis, for river blindness, for escheriasis, for lymphatic filariasis, for many other parasites, including strongyloidiasis. In COVID-19, even this ivermectin has been used. We know that in river blindness, there are millions of people, they are having a very poor quality of life after blindness, and it was very common in Africa. So ivermectin decreases the liver blindness, and it is one of the drug that has saved million of lives in Africa. In COVID-19, the encouraging results were seen, especially in early COVID-19, and many scientists, even in Pakistan, many doctors, they have used ivermectin and they found good results, and it has been published in many good journals. As far as ivermectin is concerned, I must say that it is one of a very important drug in the chemoprophylaxis of scabies. It is one of the drug that has been included in the essential list. It is one of the drug that has won the Nobel Prize for saving millions of lives, especially for parasitic diseases, and by decreasing river blindness. Another important point that I want to highlight here is about the collection of these samples, and how the different diagnostic techniques have been applied. Essentially, the scabies, it is a clinically diagnosed disease. Usually, there are the scratch marks along with the typical furrows that are present on the web spaces, etc. So the diagnosis, it is not clinically based. However, the screen scrapings can be used if there is any case of doubt that is present. If anybody has any question, you are most welcome to ask, please.
Thank you, ma'am.
Okay, thank you very much. I think we should end our class here. Allah Hafiz.